Bismillahirrahmanirrahim. Quote of the day. Abu Huraira Raziyallahu Ta'ala anhu narrated that Messenger of Allah Sallallahu Alaihi Wasallam said, whoever relieves a hardship for a believer in this world, Allah will relieve one of his hardship on the day of resurrection. Assalamu alaikum. I'm Dr. Nabeela Umar, and today I'm going to present the topic types of hypothesis, p-value, alpha and beta error, and power of study under the kind supervision of Professor Dr. Saira Aksar. What is a p-value? It is defined as the probability of obtaining a result equal to or more extreme than what was actually observed. It was first introduced by Carl Pearson in his Pearson chi-square test. It can also be seen in relation to probability of making a type 1 error. According to this graph, the green shaded area is the p-value. It is the probability of an observed result arising by chance. The vertical coordinate is the probability density of each outcome computed under the null hypothesis. The p-value is the area under the curve past the observed data point. Cutoff for p-value. The arbitrary cutoff for p-value is 0.05, which means that 5% chance of a false positive conclusion. If p is less than 0.05, it is statistically significant, and we will reject the null hypothesis and will accept the alternate hypothesis. If p is more than 0.05, it is statistically non-significant, and we will accept the null hypothesis and reject the alternate hypothesis. Testing potential harmful interventions, alpha value is set below 0.05. It depends on the research question. P-value degrees of magnitude. If p is very small, for example, less than 0.001, the results are said to be highly significant. Near 0.05, it is said to be borderline significant, and near 1.0, result does not matter. Statistically significance does not necessarily mean real significance. If sample size is large, even small differences can have a low p-value. Lack of significance does not necessarily mean null hypothesis is true. If sample size is small, there could be a real difference, but we are not able to detect it. If you perform a large number of tests in a study, 1 in 20 will be significantly merely by chance. What is alpha and beta errors? Type 1 error, or which is known as alpha error, this is a chance or probability that you will reject a null hypothesis that should not have been rejected. This will result in you deciding two groups are different or two variables are related when they are really not. The probability for type 1 error is called alpha. Type 2 error, or which is also known as beta error, this is the chance or probability that you will not reject a null hypothesis when it should have been rejected. This will result in you deciding two groups are not different or two variables are not related when they really are. The probability of a type 2 error is called beta. According to this table, when the null hypothesis is true and you reject the null hypothesis, this is known as type 1 error. And when the null hypothesis is false and you fail to reject the null hypothesis, this is known as type 2 error. For example, null hypothesis state, person is not guilty of the crime. According to type 1 error, the person is judged as guilty when the person actually did not commit the crime. Type 2 error, the person is judged not guilty when they actually did commit the crime. Another example, according to null hypothesis, a medicine A cures a disease B. According to type 1 error, the null hypothesis is true but rejected as false. Medicine A cures disease B, but it is rejected as false. Type 2 error, the null hypothesis is false but accepted as true. Medicine A does not cure disease B, but is accepted as true. Power of the study. Power of the study is the ability to detect a statistically significant association. It can also be seen as the probability of not missing an effect due to sampling error when there really is an effect. It is also the probability of avoiding a type 2 error, that is beta error. A prospective power analysis is used before collecting data to consider the design sensitivity. A retrospective power analysis is used in order to know whether the studies you are interpreting were well enough designed. Statistical power can have answers questions like these. How large must my sample size be? How should I design my experiment? What Meyer's test should I use? I can get about X amount of people in my study. Will I have enough power? Factors affecting power. As sample sizes increases, the power increases. As population variances decreases, the power increases. As the difference increases, the power increases. Statistical power is greater for one-tailed test. The greater the probability of making a type 1 error, the greater the power. What is 80% power? Power is usually set as 80%. This means that if there are two effects to be found in 100 different studies with 80% power, only 80 out of 100 statistical tests will actually detect them. If you don't ensure sufficient power, your study may not be able to detect a true effect at all. Types of hypotheses. Hypothesis is considered as an intelligent guess or prediction that gives direction to the researcher to answer the research question. It is defined as the formal statement of the tentative or expected prediction or explanation of the relationship between two or more variables in a specified population. A hypothesis is a formal tentative statement of the expected relationship between two or more variables under study. It helps to translate the research problem and objective into a clear explanation or prediction of the expected results or outcomes of the study. Contributions of hypothesis. It provides clarity to the research problem and research objectives. It describes, explains, or predicts the expected results or outcome of the research. It indicates the type of research design and directs the research study products. It identifies the population of the research study that is to be investigated or examined. It facilitates the data collection, data analysis, and data interpretation. Now, what is the function of a hypothesis? It enables an investigator to start his research work. It may lead to formulations of another hypothesis, or it leads to interpret results drawing conclusions related to original purpose. Characteristics. A hypothesis must be capable of verification. A hypothesis must be related to the existing body of knowledge. A hypothesis needs to be precise, simple, and specific. Types of hypothesis. It can be simple, complex, empirical, null and alternative, directional, non-directional, logical, statistical, or casual. Simple hypothesis. Simple hypothesis is that one in which there exists relationship between two variables. One is the called independent variable or cause, and the other is the dependent variable or effect. For example, smoking leads to cancer. The high ratio of unemployment leads to crimes. Complex hypothesis. Complex hypothesis is the one in which as relationship among variables exist. In this type, dependent and independent variables are more than two. For example, smoking and other drugs leads to cancer, tension, chest infection, etc. The high ratio of unemployment, poverty, illiteracy leads to crimes like dacoit, etc. Empirical hypothesis. Empirical, which means it is based on evidence. In scientific method, the word empirical refers to the use of working hypotheses that can be tested using observation and experiment. Empirical data is produced by experiment and observation. Question form of hypothesis. It is the simplest form of empirical hypothesis. In simple case of investigation and research are adequately implemented by resuming a question. For example, how is the ability of 9 class students in learning moral values? Null hypothesis. A null hypothesis is formulated against the working hypothesis, opposes the statement of the working hypothesis. It is contrary to the positive statement made in the working hypothesis, formulated to disprove the contrary of a working hypothesis. When a researcher rejects a null hypothesis, he actually proves a working hypothesis. In statistics, to mean a null hypothesis, usually this symbol H and O is used, where Q is the property of the population under investigation. Alternate hypothesis. An alternate hypothesis is formulated when a researcher totally rejects the null hypothesis. He or she develops such a hypothesis with adequate reasons. The notion used to mean alternative hypothesis is H and 1, where Q is greater than O. Examples. Working hypothesis is population influences the number of bank branches in a town. The null hypothesis will be populations do not have any influence on the number of bank branches in a town. But the alternate hypothesis will be that population has a significant effect on the number of bank branches in a town. The researcher formulates this hypothesis only after rejecting the null hypothesis. Statistical hypothesis. A hypothesis which can be verified statistically is called a statistical hypothesis. The statement would be logical or illogical, but if statistic verifies it, it will be a statistical hypothesis. Directional hypothesis. Directional hypothesis predicts the direction of the relationship between the independent and dependent variable. For example, high quality of nursing education will lead to high quality of nursing practice skills. Girls' ability of learning moral science is better than boys. Non-directional hypothesis. A non-directional hypothesis predicts the relationship between the independent and variable and the dependent variable, but does not specify the directional of the relationship. For example, teacher-student relationship influences students' learning. There is no significant difference between 9th-class boys and girls' ability of learning moral values. Causal hypothesis. Causal hypothesis predicts a cause and effects relationship or interaction between the independent variable and dependent variable. This hypothesis predicts the effect of the independent variable on the dependent variable. Causal hypothesis example. For example, question, does marriage cause baldness among men? The causation hypothesis, marriage causes stress, which leads to hair loss. Another example is, what is the relationship between recreational drugs and psychosis? Recreational drugs causes psychosis. Associative hypothesis. Associative hypothesis predicts an associative relationship between the independent variable and the dependent variable. When there is a change in any one of the variables, changes also occurs in the other variable. For example, sick people in a hospital. You could conduct a study hypothesizing that hospitals have more sick people in them than other institutions in society. However, you don't hypothesize that the hospital caused the sickness. A research was published in a journal. The abstract was, hypothesis testing forms an important domain of inferential statistics. It also forms a stepping stone to evidence-based medicine. A narrow research question leads to the formulation of a research hypothesis, which is put into test in order to draw statistical inference. A researcher believes in the alternative hypothesis, which states that there is a treatment difference between two groups in contrast to null hypothesis, which believes in no difference. The hypothesis tested on a sample population after setting the significance level. The researcher uses the right statistical procedure to arrive at a statistical decision, which helps in rejecting the null hypothesis or otherwise. A p-value with confidence interval helps in interpreting the results of the hypothesis testing better. In case where multiple hypotheses needs to be tested simultaneously, the alpha error rate must be controlled, which can be done by various methods. A newer method of hypothesis testing is by using Bayesian methods, which uses basis factor in assessing the plausibility of the hypothesis. Are only p-values less than 0.05% significant? A p-value greater than 0.05 is also significant. Statistical hypothesis testing compares the significance probability value and the significance level value to determine whether or not to reject the null hypothesis. This concludes significant or non-significant. However, since this process is the process of statistical hypothesis testing, the conclusion of statistical significant or non-statistical significant is more appropriate than the conclusion of significant or non-significant. Also, in many studies, the significance level is set to be 0.05 to compare with the significance probability value, which is p-value. If p-value is less than 0.05, it is judged as significant. And if the p-value is greater than 0.05, it is judged as non-significant. However, since the significance probability is a value set by the researcher according to the circumstances of each study, it does not necessarily have to be 0.05. In a statistically hypothesis test, the conclusion depends on the setting of the significance level value. so the researchers must carefully set the significance level value. The stages of statistical hypothesis testing were examined in detail and the exact conclusion accordingly, and the contents that should be considered carefully when interpreting them were mentioned. Multiple choice questions. MCQ number 1. Introducing fluoride to the water system in the city of Austin decreases the number of dental visits per capita per year. This is an example of which type of hypothesis? A, unidirectional, B, non-directional, C, complex, D, simple, or E, null.
It's simple. D.
A, unidirectional.
Alpha. Yes, the answer is A, unidirectional. MCQ number 2. A clinical trial is conducted to evaluate a new antihypertensive drug. The null hypothesis states that the drug has no effect. The p-value obtained is 0.03. Number A, the null hypothesis should be accepted. B, the result is not statistically significant. C, there is a 3% chance that the null hypothesis is true. D, the result is statistically significant and the null hypothesis is rejected. Or E, a type 2 error has occurred.
C.
C.
The answer is D. The result is statistically significant and the null hypothesis is rejected. MCQ number 3. When a researcher rejects a true null hypothesis in his study and accepts the alternate hypothesis, what type of error is likely? A, type 1 error, B, type 2 error, C, beta error, D, logical error, or E, both type 1 and 2.
Type 2 error,
Type
B.
1 error.
Alpha.
A. Answer is
Alpha.
A.
Yes, the answer is A,
Alpha.
type 1 error or the alpha error. MCQ number 4. A public health researcher is evaluating the effectiveness of a new nutritional intervention for underweight children in a rural country. Before the trial begins, a power analysis is conducted and the power is set at 80%. Later, the study results shows no statistical significant difference between the intervention and the control group. Which of the following best describe what 80% power means in this context? A, there is an 80% chance the intervention will work in the community. B, the probability of finding a statistically significant result if a true effect exists is 80%. C, the null hypothesis is 80% likely to be true. D, there is an 80% chance that the p-value will be less than 0.05. Or E, the study will correctly reject the null hypothesis in all significant cases.
D.
E, D. Delta.
I guess D or C.
The answer is B. The probability of finding a statistically significant result if a true effect exists is 80%. MCQ number 5. A nutritionist is planning a research study to assess the impact of a high-protein supplementary diet on weight gain in underweight children aged 6 to 59 months in a rural district. She expects that children receiving the new diet will gain more weight compared to those to the standard government-provided food. Which type of hypothesis is she most likely formulating? A, null hypothesis, B, non-directional hypothesis, C, directional hypothesis, D, complex hypothesis, or E, empirical hypothesis.
C, directional hypothesis.
Yes, the answer is C, directional hypothesis. MCQ number 6. A healthcare research team conducts a study to compare the effectiveness of two community-based interventions aimed at improving hand hygiene among mothers of under 5 children. The results show no statistically significant difference between the two interventions. However, a post-study analysis reveals that the sample size was smaller than planned and the effect size observed was clinically important. What type of error is most likely to have occurred in this situation? A, alpha error, B, type 1 error, C, type 2 error, D, logical error, or E, nullification bias.
Alpha error.
Type 2 error.
The answer is C, type 2 error. MCQ number 7. Age and obesity increases your chance of getting diabetes and heart disease. What hypothesis is best represented in this statement? A. Null hypothesis. B. Alternate hypothesis. C. Simple hypothesis. D. Non-directional hypothesis. Or E. Complex hypothesis.
B.
B. E. Complex hypothesis.
E.
Yes, the answer is E. Complex hypothesis. MCQ number 8. A researcher is evaluating the impact of a new vaccination awareness campaign on immunization coverage in a low-resource community. Despite no real difference in coverage rates, the study results indicate a statistically significant improvement post-intervention with a p-value of 0.03. Later, investigation reveals that the observed difference was likely due to random variation rather than the campaign itself. What type of error has most likely occurred? A. The study was underpowered. B. A type 1 error occurred by incorrectly rejecting the null hypothesis. C. A type 2 error occurred by failing to detect a real effect. D. The null hypothesis was correctly accepted. Or E. The sample size was too small to yield valid results.
Type 2 error.
Type 2 error.
The answer is beta. A type 1 error occurred by incorrectly rejecting the null hypothesis. MCQ number 9. Which of the following is true about a type 1 error? A. False negative confusion. B. Occurs when null hypothesis is accepted mistakenly. C. Probability of it is represented by beta. B. It is rejecting a true null hypothesis. Or E. Happens when sample size is large.
Delta.
B.
Delta.
The answer is D. It is rejecting a true null hypothesis. MCQ number 10. A pharmaceutical company claims that the new drug is effective in treating headaches. They conduct a study in which they give the drug to 100 people with headaches and find that 75 of them report a significant improvement in their symptoms. The company wants to test the hypothesis. Which of the following is the correct null hypothesis? A. The drug is not effective in treating headaches. B. The drug is effective in treating headaches. C. The drug increasing the frequency of headaches. D. The drug is equally effective as a placebo in treating headaches. Or E. The drug is more effective than a placebo in treating headaches.
B.
D.
Beta.
A.
A. Delta.
The answer is A. The drug is not effective in treating headaches. This is the key to the MCQs. This is a YouTube channel where the presentation will be uploaded. Thank you for your attention.
Thank you very much, Dr. Nabeela. This is a wonderful presentation and a very important topic. As we all know, that hypothesis is very important to build in our research. All our research revolves around a good hypothesis, which is an assumption that is made based on some evidence, and the evidence comes from a good literature review. Whenever we talk about hypothesis, it should be testable. The most important point that should be made in every presentation is that the statement of the hypothesis should be testable and tentative with this relationship between variables or an explanation for a phenomenon that has a formulation based on evidence. So if the hypothesis is strong enough, then the whole study that flows in a smooth manner. If the hypothesis is not according to the standards or is not according to the types of the hypothesis as mentioned in the literature and as you have stressed in your presentation, then there would be the difficulty in applying the statistical tests, in concluding the research, as well as coming up with any outcome. So the hypothesis should be written with a very strong foundation. More important is that whenever we are testing a hypothesis, appropriate test of significance should be applied. How can we do it? First, we have to identify the type of hypothesis. For example, if it is bidirectional, then the 0.05 p-value will be divided in two extremes of the hypothesis. For example, if there are two drugs, drug A and drug B, and both are being compared with each other, and we have bidirectional hypothesis, then it is possible that the hypothesis one or the alternate hypothesis is that the drug A is better than drug B. The other hypothesis is drug B is better than drug A. Null hypothesis is that both drugs A and B have the same efficiency and efficacy, and there is no difference between the two. So hypothesis should be tested according to the direction of the hypothesis. Second, if it is unidirectional, we know then the p-value stand at 0.05 and it is towards one extreme. For example, the drug A is better than drug B, and the null hypothesis stands that the both the efficacy of drug A and B is same. Moreover, whenever we talk about the hypothesis, we have to give the type of the tails that are involved, either it be one-sided or the two-tailed hypothesis. Again, the significance is that the statistical test is based on these things. Every investigation, when it is made as a research question, when it is being tested, then it should be present according to the types of hypothesis. And the simple, complex hypothesis, directional, non-directional, null hypothesis, or the alternative hypothesis should be written clearly in every proposal or synopsis. So these are my few everyone for attending.